Ethical leadership is about doing the right thing. Ethical principles won't tell you what to do, but they will guide you in good decisions. It's about demonstrating through your behaviour ethical conduct, being open, transparent, non-judgmental, collaborative, inclusive, yet carefully balancing that with evidence, sound data and information to guide good decisions. In the Australian Ethical Health Alliance, it aims to improve healthcare in Australia through the articulation and affirmation of ethical principles that promote the interests of patients, consumers, enhance access to safe and effective healthcare, encourage ethical collaboration in the healthcare sector, and build public trust. Human health is all about people. The Australian Consensus Framework for Ethical Collaboration in the healthcare sector contains 5 substantive principles and 10 procedural principles. Now, one of those procedural principles is integrity, and it's described as the following. Those engaged in collaborations are alert to competing and conflicting personal, professional, organisational interests and to the management of bias. Better health outcomes can be achieved through demonstration of integrity by all players in the health system. Now, evidence-based decision-making that's open, and so another procedural principle is testability. These are judgments and decisions made by those engaging in collaboration that are open to independent verification and revision. Similar to an organisation's purpose, values of an organisation should be sustainable through cycles, periods of disruption, change. Values are timeless. The right ethical principles today should continue to apply as relevant and helpful in 5 to 10 years. An ethical organisation lives and breathes its ethical framework, comprised of purpose, values, and principles. Australia has learned that creating an environment to harness the goodwill of good people wishing to make a difference is key. That leveraging and encouraging contributors to feel part of the movement in a manner that is not overbearing, rather complementary to their everyday roles in life. Australia's learnt the importance of maintaining momentum, that access to resources, not expensive ones, are key to ensuring that strategies and actions are progressed, that the practice of good governance, meeting rhythm, follow-up, regular communication is effective, and looking to raise the profile of the ethical movement through publications in journals and so on has been effective. There will always be dilemmas. We should expect that as a matter of fact in our everyday lives. The challenge is how we respond, the way in which we seek to engage, the tone, the approach. Actions speak louder than words. There will always be a tension between the profit motive, perhaps ranking higher among some participants in the sector, and the best course of action for the patient. For example, financial incentives should not influence the doctor-patient relationship. Ethical leadership is about how do you balance these competing interests. It's about demonstration, role modelling, mentoring, education, awareness and guidance, and also understanding the consequences are key of unethical behaviour. And it's respecting that everyone has a role to play, that we must take the time and effort to invest in relationships to better inform a path ahead.